Welcome to the office. Ciao.
Ciao.
How are you, Sophia?
Good, thank you.
Welcome to the office.
Thank you.
How can I help you?
So I have a lot of problem on my back,
Okay.
and every day I have pain on
The
my
middle of your back or the lower back?
lower back.
Lower back. Okay.
Yes, and on my neck
Okay.
also, and I have migraine.
When did all this start?
Around 5 years ago.
5 years ago.
Yes.
What happened 5 years ago? You had an accident?
No, nothing.
So 5 years ago, what was first? The low back started first, the migraines?
Migraine.
Migraine started
Yes.
first. And when you say migraine,
Mm-hmm.
whole face.
Yes, whole face, especially here
Okay.
and in this part.
Okay. And did you take medication? Did you
Yes.
do supplementation?
Tryptane,
Okay.
but doesn't work.
Okay. 5
And-
years, you still have it?
Not every 5 years.
No, you still have migraines today?
Yes.
And in 1 week, how
Mhm.
many days a week you have it?
It depends.
2
Not
days?
every day, but maybe one day per week.
Okay.
Yes.
Which is still a lot.
Mm-hmm.
Okay. And
This is the big problem for me.
okay, that was number 1.
Yes,
Okay. What's number 2?
the back.
The low back.
Yes.
Started also 5 years ago?
No, 2 years ago,
Okay.
like that.
Were you doing something when you felt it?
No, maybe I rest.
So you woke up and you started to feel it, or it was during the day you
During
started?
the day and when I wake up every day.
Every
I
day.
have, yes, a pain on my lower back,
Lower center, lower right side.
center.
Lower center.
And the pain go down on my leg,
Okay.
the right leg.
Does it go down to your knee or into your foot?
No, to your knee.
Oh, to the knee.
Yeah.
So the first answer when someone says the pain goes down to the knee but it doesn't go past the knee, we're thinking there's a pelvis misalignment. Okay. If someone says it goes down to the foot, the ankle, the toes, we're thinking something in the spine,
Okay.
more in the lumbar spine or sacrum.
Mhm.
Okay. All right. So number 1 is migraines. Number 2 is low back. Low back started 2 years ago.
Yes.
No accident you remember 2
No.
years ago, and it started. Now it's every day. It's going down your leg every day as well.
Yes.
And when you wake up, or after you move around a bit.
When I wake up like this. Oh, every
You're
day.
too young for this.
Yes.
Come on.
But maybe my back is 150 years old. I don't know.
Okay. We'll see. We'll take a look at it.
Yeah.
Then. So we have migraines. We have back pain.
And on my neck
Okay.
here.
Tension
Yes, a lot of tension here. This part,
to the left side.
left and right.
Both sides.
Both.
So she's speaking of her trap muscles, her trapezius muscles. And
I have also my foot,
which foot?
the left.
Left foot.
Yes.
You
It's
twisted
not-
it?
Yes, inside.
Did you have an injury?
And this cause my when I walk, I can't walk well because my
Point,
left.
show me. Where?
Yeah, this
Right-
will go inside.
Right here?
Oh yeah.
So what she's talking about is a talus. Did you injure your ankle in the past?
No, I think no.
Okay. You play any sports when you were in
I
school?
was a dancer,
What kind of dance?
classic.
Oh, nice.
Yes.
Cool.
Yeah.
I'm sure you've had some injuries. I'm sure you've had your falls practicing.
Because yes, you know the
So classical, you're on your toes a lot. Yes, pirouettes, all that stuff.
yes every time.
Okay.
Mhm.
I take care of a lot of dancers, all types of dancers.
Mhm.
Okay, so I know something about dancing injuries,
Okay.
and we'll go over all that. Okay, that's a good start.
Mhm.
Okay, how about your sleep? Is okay? You can
Yes,
sleep.
I can sleep every night.
Okay, and how about your digestion?
Sometimes it's not very good. Sometimes
Yeah, we
because
got-
I have also I have a pain like there. Sometimes.
So you guys are listening to a baby in the background over there. Don't get the baby. She came with a friend who referred her who's a patient, and she just had a baby, and so we're hearing the baby in the background. All good. You good, dude? All right, cool. All right. Okay. Stomach.
And yes, sometimes it's
Bloating?
like
During cycle time, it bloats more, or it doesn't matter?
no, it doesn't matter.
Okay. All right.
Yeah.
Well, you're in for a treat today. We're going to give you some answers.
Okay.
You ready
Thank
for
you.
me?
Yes.
Okay, so here's what we're going to do. We're going to go over your x-rays first. I'm going to examine you,
Okay.
and then we're going to start your first adjustment.
Okay.
I'll see you about 3 visits, and we'll figure out your case.
Okay.
And then from there, we'll decide what to do.
Okay.
Okay?
Yes.
You ready?
Thank you so much.
All right, let's do it. We can see there is curvature in the spine, right? Okay. Some people will call it scoliosis. We're going to see is it really a scoliosis, or is it curvature due to some sort of injury? Okay. All right. So first thing is, we're complaining of the neck up here. We can see there's some curvature here, and when we're out of balance, what happens is the body starts to compensate. So the muscles start to work a little bit harder than normal. Okay. But we can see this is not really stable. So when you're complaining of your neck and shoulders, first we need to go down to the foundation. So let's talk about the foundation. Okay, so we can see a few imbalances going on in the foundation. So let's talk about this first. Number one, we have a lowered leg on the left. So the left leg is a little bit lower. Right now the measurement is 4 millimeters. The good news is it's still under 6, so adjustments will still hold. Okay, so that's the good news there. But what we can see is you have a tilted tailbone. This is what started this whole process. And when I'm looking at the tailbone here, this is the sacrum. So what I'm looking at is this. I'm looking at this here, okay? This is the tailbone. And what I see is the left side is actually dropped down 6 millimeters. You see that? That's number one. Now the question is, where did it come from? We have a dropped tailbone. We have a dropped tailbone and a slightly lowered leg on this side. We also have a misalignment of the pelvis, and I'm going to explain it now. I'm going to put it together for you, and then we'll continue. Okay. So when we're looking at the tailbone and your pelvis, this is your left side I'm talking about. Your left pelvis, it goes up and it turns out. Your tailbone goes down on that side, and then the whole thing goes down on the left. That's the imbalance. So from there, what's happened, the body has compensated. And how it's compensated is this, look. So from the drop tailbone, you see the spine starts to curve to the left side, yes? Yes. Now it starts to come back to neutral here. If the body didn't compensate, where would your head be? Way over here. So what the body does, it compensates to come back to neutral. It's coming back here to neutral, coming back, but it doesn't stop, it keeps going. So all of this going through your body from here, all of this is compensating for this tailbone on the left side, okay? Now, the good news, number one, the bones haven't fully changed shape. So besides adjustments, there are exercises in rehab that will give you down the road to help you try to straighten a little bit of it out. But that's not my goal. My goal is to get your foundation right and get your curves right on the other x-ray. Okay. And I'll explain when I get there. So these bones have not changed shape yet. This one, maybe you have a lot of tension. You hold your tension here in this part of your back. Yes. And this part of the spine is the area that controls the adrenals, the stress button. Okay. Okay. Now, as we go up, 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 up. Again, compensation all the way to the top. How is your nose? How's the breathing?
I can breathe.
Yeah, so we do have a little bit of deviation of the septum. I'll work on that for you too. I do all that for you. Okay. Okay?
Oh my God.
Yeah. And you've watched some videos. I have videos of working. The jaw is also misaligned, the right jaw.
Yes, here.
And you click on the left or you click on the right. Does it pop open and close?
Click.
On the right.
Maybe.
Right side. Okay. All right, we'll deal with that. Now, the thing I want to see next is I want to do the posture line from here. So we're going to go from the bottom and we're going to go straight up. And it's just barely off, which is good news. And what I'm doing is I'm going from the sacral tubercle all the way up to, I'll explain it, all the way to the dens, and the dens is right there. And what it's showing us, if this thing is right there, then there's no change that I'm going to make there, but it is slightly off a little bit. There is a possibility you will get some change on this spine, on this x-ray, okay?
Okay.
But again, that's not my goal. My goal is stabilize this foundation. Now, you've had injuries, and I'm going to show you. So whether you remember them or not, you ask your mom or dad. And what I'm seeing is right there. It's starting right there. If I take this line, look, I'm going to draw a line. You see these lines right here?
Yes.
Okay. That's the coccyx, S5 coccyx. If I draw a line through this, okay, and if I take that line and go with the hip, you see how they're parallel, they match. So you had an old tailbone injury that threw your tailbone off balance that started this process.
Okay.
You ask mama, whether it was dancing or whether it was, I'm sure you started when you were very young?
3 years. Okay.
I'm sure you've had some stuff. And when you go back to some of my videos, I talk a lot about these childhood injuries.
Okay.
That, you know, what happens? You slip, you fall, what does your teacher say? Get up.
Yeah.
Right? Deal with it, get up, come on, let's go.
Yes.
Otherwise leave. And what's mama gonna say?
The same.
Exactly. And we're not mad at parents, okay? You know, but one of the things and why we share stories, and I appreciate sharing the story, is that more people need to know where this stuff comes from. Okay, is that clear?
Yes.
Okay, so we're going to be starting down low here. I have to work on this tailbone, and I have to bring this tailbone up on that side.
Okay.
That's the fun part.
Yes.
Okay. Now, let's go back. Let's go to this x-ray. And the first answer you're going to get is for your shoulder tension. And when we look at the posture, we're going to run a posture line. We're going to run it from the center of the low lumbar, and we're going to run it straight up. Yeah? And guess where this line is supposed to be? It's supposed to be going through your neck here. So what it's showing us is you carry the upper part of your body behind. When you're standing straight, it's behind your foundation. So what happens is these muscles, look, it's supposed to be here, back here. So these muscles have to work overtime. They have to do too much work when you sit. So I know you get tense, you get tight when you're sitting, and you get tight across here, correct?
Yeah.
Okay. Now, the answer is why is your posture back? That's what we're going to get to. But this is a result of your posture. Okay. Now, there's your tailbone. This is your tailbone. And the tailbone consists of 5 pieces, 5 sacral pieces that mature around age 32 to 34. I have many cases in their 50s and 60s that we work on, 70s even. But what I'm showing you here on this tailbone is this should be a smooth curve. You had 1 injury there, 2, and 3. You had at least 3 tailbone injuries that I see. You ask mama, you'll think about it later, okay? But this is the main thing here. You see this. This injury, whatever happened here at S5, is what tilted the tailbone. Okay.
This is my pain here.
Yes, that's what you feel, right?
Yeah.
Okay, and that's what we're gonna start on hopefully today. So number 1 is the tailbone injury. We have the posture, the sway back. Curvature, let's talk about your curves. When we're looking at the low back curve is okay. Could have a little more. You have what's called a sway back, we said. So we want to bring this forward, okay?
Yes.
Now, this is the interesting part. When we get to the neck here, you're developing the reverse curve. And part of it, there's a couple of reasons. Number 1, we all live like this now, okay, phone, but that's not why your body is doing it. Your body is doing it because the upper part of the body is so far behind the foundation, the neck is compensating forward to keep you balanced. So if you keep the right curve, you're off balance.
Yeah.
Okay, you tend to go back. Okay, so then when you slouch in the couch nice and soft, it feels comfortable, right? So we're going to change that today. I'm sorry. Okay, does that make sense so far? Make sense?
Yes.
Okay. Now we'll talk about the good news. Your discs are good.
Oh.
That's the good news. If we look at the discs from the bottom, this is great. This is tilted a little bit, but it's fine. That's from the compensation of the curve. These discs are all fine in here. These discs are all fine. I'm going to zoom in. These discs are all fine. I can't see this one here, but we'll look on the other x-ray. Let's look at this. I'm going to change the factor a little bit, and let's look at the curve. This needs to be a 40 to 60 degree forward curve. So one of the things you don't want to be using too much pillow. If you have, your pillows are nice and fluffy and thick, it keeps that head forward. So I would suggest starting today, use a towel right now.
Towel.
A towel. And I'll show you how to do it later, okay? I want you to see this. You see this one here, 2, 3, 4, 5, 6, number 7. Number 7 is tilting back, 6 goes with it, 5 goes with it, 4, 3, 2 start to go in the opposite to compensate. So we have a potential issue here at the base of the neck, number 7, which controls the shoulders and the arms. We have a potential we talked about in the tailbone, 3 potentials. We're not doing all 3 at once. We have to figure out where we're going to start. Okay?
Okay.
Make sense there? Clear?
Yes.
Okay. Let's go back to this x-ray. And in terms of looking at this, we said we're going to work on the foundation. I will look at your TMJ and septum as well. Okay? Make sense?
Yeah.
Questions?
How about hernia?
Herniated disc?
Yeah.
What number did they say?
This part?
Yes. So that's what we're going to fix.
Ah, okay.
Okay? But in the way
there is only one.
When I check, I will show you.
Ah, okay.
Okay? When I check, I'll show you exactly what number the problem is.
Okay.
Okay? All right? And that's what we want to fix. But you don't have a hernia, you have a herniated disc. That's they told you a disc. Correct?
Yes.
Did they tell you L5, S1? Do you remember?
L1, S5, maybe?
L5, S1?
Maybe,
Okay.
yes.
So looking at L5, S1, let's look at it and let's talk about it. So if we look at L5, the disc is good. Maybe it's a little bit swollen, but the answer doesn't start there. Okay. This is the first floor of the building. I'm going to be in the basement. Okay? We have to stabilize the basement, and then we'll see if we have to work on the first floor or the first floor takes care of itself. Okay? Okay? Clear?
Clear.
Cool. Claro?
Claro.
Claro. Tell me, you were saying something. You wake up in the morning and it hurts, and you said you have trouble doing what movement?
I can't do like this.
You can't straighten out your back?
Yes, but I can't like this.
You can flex forward?
No, I can't go down.
So show me how far down you can go before it hurts.
Right there. I have pain now. Like
Right there?
Oh, yeah.
And it hurts here. Okay, come up. Now go put your hands on your back here and go back slowly. Tell me when it starts.
Oh, no. Okay.
Right there?
Yeah.
Okay. And it's in the same area?
Yes, but I don't have the same pain.
It's a different pain?
Yes.
What's
it's less.
different?
It's less. When I go like that,
okay.
It's less than when I go.
So flexion is more pain?
Yeah.
Got it. Okay. I want you to walk to the corner of the room and back 2 times, please. You're from what part of Italy, you said?
Near Rome.
Near Rome.
Close Rome.
Okay, so we'll just call it, keep walking. So when she's walking, you can see the right side, it hikes up when she walks. So when I'm looking at the dimples in the back, it should move like this. You move like this. You got the Roman shuffle.
Yes, like this.
Yes, it shuffles. Keep walking one more time. Okay, keep walking. Actually, keep walking. I'm watching her feet. So she pronates the left foot when she walks. All right, lady, we got work to do. Come on over. Now, let's run the meter on the back, starting at the base of the neck. And the first thing we're getting, C6, C7, left side, 10 points. 15 points, hold on, 6 points, left side, C1. Now, migraines can come from anywhere. It can be in the neck, it can be in the mid-back, it can be in the pelvis even. And we've had many, many, many migraine cases over the years. And every one of them was a different answer. There's a nutritional component that I'll talk about later as well. And we'll see if we don't get a result that we expect in a couple of adjustments, then I'm going to add one supplement for you, okay?
Okay.
T18-9, left side. And if you look at the overall presentation of her back, she's red here. Now, the way I need her to sit, this is the upper part, this is the lower part. Put a curve, sit forward, and then as soon as she has the right curve here, you see how this whole thing sways back. This needs to go forward, and the neck needs to go there. Bring your belly button in and up. No, just your belly button in and up. And put a curve. She's not comfortable. It's not comfortable, right?
No.
Okay, go back to whatever's comfortable.
Oh.
Okay, let's continue. So, T9, 10 points. And there it is. S5, Coccyx, down low. Don't stop, please. S5, Coccyx, left side, 10 points. T9, C6, C7, and C1. Those are the 4 pressure readings that I'm getting, okay?
Okay.
The next thing we're going to do is check the movement in your hips. My fingers are here on the pelvis and on the top of the iliac crest. Feet together, mariposa. Okay, left side only. No, left.
Oh, sorry.
That izquierdo. When she does the left, the whole right wants to shift, and it's actually shifting up top too. Right side only. Do the right, derecho. When she does the right, the left shifts, not as much here, but it's shifting more from the muscle I'm feeling here. Stop, please. Sit back for me. Para atrás. Good. Head down. Look down. And static palpation, running our fingers down the spine, looking for swelling, edema, and point tenderness. And what we can see when we get to right there, that's where the inflammation starts. And it pulls in there. Tickle. Am I tickling you or pain?
No, it's comfortable. Oh, no, it's pain. No.
Pain, right? Number 9 or number 8?
9.
9. 10. 9.
9.
9.
9, more 9.
9. That's the stress button. Okay. Now, let's check the low back. Come back. This is number 5, okay? Pain when I push? Well, that's what you were telling me, herniated disc. L5, but let me show you. S1, more pain. S2,
Yeah.
S3, yes? See?
Yeah.
S4, see?
See.
S1, C.
See.
S2, C. S3, C. S4,
Yeah.
C. S5. Okay, I'm on the outside, down in the coccyx, please, right there. See, that's where it's all starting. Sorry. I'm just showing you. It's not L5. It's coccyx, down in the bottom.
Oh.
Okay, let's check the neck now. So what we're doing is we're checking extension. She's very guarded when I do this. Yes? 6, 7. 7 pain?
Yeah.
6 is also, but more at 7.
Yes.
Yes. Bend left.
Yeah.
Yes.
Ah.
Mamma mia.
Mamma mia.
Mamma mia. Left.
Oh.
Right. Okay. That's actually C2 on the left, C1 on the right, but we're going to wait on the upper cervical. Okay. Here's the game plan for today. This is what we're going to do. We're going to do coccyx first on the side, here. Then we're going to go over there and do more of your sacrum.
Okay.
Then I'm going to have you walk. Then we're going to do T9, the mid-back. After that, I'm going to have you walk. Then I'm going to check your neck if I'm doing the lower or upper. I don't do two upper and lower unless it's, you live here.
Okay.
Okay, so I don't have to do all this in one day. Okay. Questions?
No.
Okay. After I do that, I'm going to tune up your shoulders, arms, and I'm going to work on your ankle, left ankle.
Yeah.
That's the one we're talking about. Okay.
Thank
You ready?
Yes.
All right, let's get started. So what we're going to do, let's go right side down, please. Lay on your right side here, del lado derecho. I will not drop you, I promise. I got you the whole way. If I drop you, free trip to Hawaii. Deal? I'm not going to drop you, don't worry. Right there. Okay? I got you the whole way. That's the home run, lady. Get her face, she's laughing. It's good. Yeah.
Oh my God. Wow.
Come on up. Walk it out. Check it out. Turn. Diferente? A little bit? Good. One more time. Come over here. Let's go face down and continue. And we're going to do more of the tailbone now. There you go. And we're going to torque this way to bring that left side up. There you go. Gotcha. Check it out. Face down again, and let's work on your T9. 1, 2, 3, 4, 5, 6, 7, 8, 9. T9. Gotcha. Gotcha. Okay, walk for me, please. A little different? Keep going. Come over here, have a seat. Let me show you. You remember what it felt like when I was pushing, right? All right, sit back for me. Look. 5. Come back. 1. 2. Different? 3. 4. Different? Yeah. Oh, wow. Yeah. Come back, look. Coccyx. Yeah. Cool. Oh, wow. Yeah. Sit back for me, please. Head down. And I just want to see what changed. Seven is still there. Let's do 7. 7 is a PLS. Okay, I'm going to do your neck now. 7. Right there. Easy. Nice and easy. Chin back. Left ear down. Good. There you go. Good. Left ear down. Down, down, down. Oh, no. Don't help. That's a piece. That's not it. You okay? Right here. Ooh, you're fighting me. Let it go. Let it go. Drop the ear. Drop, drop. Come on over here. You're fighting me over here. Oh, yeah. Come back here.
Oh.
Come on over. Face down.
Maybe because I'm...
You're tense a little there. I get you here. Don't worry.
Okay. Sorry.
All good. Just a little space down. That's it. Yes. Siéntate derecho. Sí. Neck is clear. There's more activity, but it's clear. Let me clarify that. There's a little bit of heat activity there, but it's clear. 7 is clear. May I continue? Okay. Ears.
Ah.
Okay. There. Shoulders. I'm going to reach over, okay? I need to work on your shoulder. I'm going to bring your elbow back this way. That's it. Relax there. There you go. Now, let's go on your back and let's check your feet. Okay, so let's test the feet out. I'm going to take the sock off a little bit, halfway. Bring your feet back all the way, all the way, all the way, all the way. So this one goes back further than this one. Relax the feet, relax. Mira. This is it, okay, right there.
Ooh.
This one,
Yeah.
little bit. This one. So we have an AS talus. We're going to go through the process now. Tender.
Oh.
Yes? Not so bad.
No.
Tender. Not so bad.
No.
AS talus, medial tilt, and inferior navicular. Those are the two we're going to work on. I'm going to prep the ankle before I adjust it. We're going to use a little bit of lotion. All right. Okay. As much as you can handle. If it's too much, I'll stop, okay? I'm working the scar tissue, the swelling. 5. And what we're doing, we're prepping the ankle for the adjustment. Come over here, please. You can see we're prepping. And what we're doing, we just take a little bit of lotion. We're on the dome of the talus. And we're working the periarticular swelling back into the joint. This is where she has that scar tissue. 5, 4, 3, 2, 1. Next, we're going to do passive range of motion. Raise up. Passive range of motion, dome of the talus, applying A to P pressure, and dorsiflex. 5, 4, 3, 2, 1. Okay. Now we're going to adjust you. Hi. How you going?
Yeah.
All set. A little bit more. Turn to the left side. We're doing the navicular, inferior navicular. There you go. A little more. Perfect. Boca arriba. Walk it out. Good job. Now, as you're walking, Sophia, walk a few times back and forth and tell us if anything is different. Let me just open the back of the gown so we can watch the dimples. Tell me what's different.
Oh, the leg. Maybe now is the same. No.
More even.
Yes.
More balance.
Yes. I can't do this. No.
You're moving a little bit better in the back. Yeah, cool.
Yeah, and also the foot.
Good.
Maybe it's more.
More balance. Yeah, more balance. Good.
Yeah. I feel comfortable now.
Good. Now here's a good test for us. Stand over here, please. Turn this way. Why don't we go ahead and touch our toes?
Oh.
What?
Yeah. No, it's good now.
Less pain
Yes.
or no pain?
No, less.
Less.
Very less.
Good. So, sit straight. Stand up.
Yeah.
Hands on your back. Go back.
It's better. Yeah.
Cool, right? Have a seat. Now we do buff and polish. We're going to use the machine. This is vibration.
Oh.
It's to break up scar tissue. Okay? Sit straight. Cool.
Oh.
5, 4, 3, 2. All right. Now, stand up, please. Stand over here. Squeeze my hand. Squeeze. I'm checking your hands now. Good. Squeeze. elbow. Relax the hand. Wrist. Thumb.
Oh, I love this.
Squeeze. Pulling is fine. People ask, don't do
All every
this.
day.
Pulling is fine. No, not this.
Ah,
This. Yes, that's fine.
I do both.
Don't do the other one, please. Squeeze. Elbow. Thumb. Lunate.
Oh,
Go like that 5 times. Squeeze. Good. Squeeze. Questions with what I did? You understand what I found?
yeah.
Okay. That's where we're going to start. No questions?
No.
Okay. So your homework, very simple. Walking 10,000 steps, no weights right now. Body weight is okay. Swimming is okay. Biking is okay.
Pilates?
Pilates is fine.
Okay.
Body weight Pilates.
I with the reformer.
Yeah, but not too much resistance, not too much weight. Your body weight, right?
Yes.
That's fine.
Thank you so much.
Welcome to the office.
Thank you.
You're welcome.